Here's what's coming up next on Comcast tonight. The doctor is in, and what's inside this little vial can make you look years younger. Keep it here. Comcast Tonight starts right now. Hi, and thanks for tuning in to Comcast Tonight. I'm your host, Janelle Wolfe. And we begin tonight in Berks County with something that some people might call a lunchtime facelift or even a liquid facelift. We're talking today about dermal fillers and what's inside this little vial and how to make you look even better. Joining me now is Dr. Harriet Comite. She is a board-certified dermatologist, certified by the American Academy of Dermatology, a fellow with that organization. Thanks for joining us today.
Thank you for asking me.
Let's talk fillers. What do I have here in my hand? Because it looks like kind of like a white powder, kind of. What is this?
It is called Sculptra. It's one of the newest fillers that's been approved. It actually plumps skin, but it takes a while. It's the only filler that does not give instant results, but it builds up over time, and it can last over 2 years.
So it's kind of like Jell-O, where it starts out as a liquid and it becomes sort of like a solid.
And you develop your own collagen around it.
I think when people think of stuff that's getting injected into their face, Botox would probably be the first thing that comes to mind. How are these products different than Botox?
Well, Botox is not actually a dermal filler. Botox, and that would make a great other show, calms muscle down. But these fillers, these type of fillers, plump your skin up. So they erase etched lines. They work instantly, whereas Botox usually takes a couple of weeks to show the results. They can give an edge to a lip, then plump up folds and wrinkles, and even scars. Certain scars can be filled with these types of fillers.
And speaking of lips, we just so happen to have a picture of a before and after with some lips. Dr. Comite, tell me a little bit about this patient and how you were able to make her smile even better.
Well, as you can see, she has relatively nice lips, but with time, lips decrease in size and they get a little wrinkly, and maybe lipstick doesn't go on that smoothly. So with a very quick treatment of, in this case, it was Restylane, we plumped up her lips, and you get instant results, and it remains there for anywhere between 6 to 8 months.
And if you can take a look now at the after, you can see the smile's much more even, and it's a little swollen in the picture, but when the swelling goes down, I mean, she's going to be hot.
Yes, I think it's pretty good right now.
Tell me, how about, the pain factor? Because some people might be a little worried when it comes to needles in the face and all that kind of stuff.
Yeah, needles in face, that's hard. But there are areas that you may not feel any discomfort at all. And some areas may cause some mild to moderate discomfort when you inject them. But there's topical anesthetic cream, which we use, as well as many of these fillers have added anesthetic in them, anti-pain medicine in them. So they definitely decrease discomfort a lot.
Oh, that's something I'm sure a lot of people aren't even aware of. Wow. What makes you happiest about doing this for your patients? Do you have any people that really stand out, of course without mentioning any names, that you think to yourself, wow, I made this person look incredible, they came in looking like X, Y, and Z, and they left looking like $1 million?
The wonderful thing about fillers is these days there's so many different choices that give you fabulous results, and they're lasting longer and longer, and most people, the results are instant. So you have a big party on Saturday night, you come in Tuesday, and you look fabulous. So
I would think that patient education is probably an issue in that the ordinary person sitting at home is probably overwhelmed looking at all these boxes and thinking, gosh, do I need Cosmoplast? Do I need Cosmoderm? Do I need Juvederm? They all kind of sound sort of the same. How would you clear it up for the person that is considering something like this?
Well, that's exactly right. The best way is to schedule a consultation with your dermatologist and discuss your goals and what you'd like to treat. And with that discussion, you can decide which filler is right for you. Some of the fillers, like Cosmoderm and Cosmoplast, face fine etched lines, or they give an excellent border, lip border, so when you put lipstick on, they don't bleed into those little fine etched lines. The other fillers, such as Juvederm and Restylane, plump deep folds and deep wrinkles between your nose and mouth and around your chin. So that would be a good dialogue to have with your dermatologist before you decide which ones are right for you.
All right, more with Dr. Harriet Comite, Dr. 19610 when we return. First, though, here's how to get in touch with us at the station, 610-790-8869, or email us your thoughts, too, story ideas at Comcast.net. Be right back.
Welcome to a world of international foods without leaving Berks County. Russo's Gourmet Foods and Market. The smells of fresh-baked breads and espresso fill the air. Choose from a bountiful selection of imported pastas and fresh garden greens. And every day, specialty foods are made right here, ready to enjoy. The Olive Bar will leave you trying to decide your favorite. And relax in the Espresso Cafe. Maybe even indulge in a gelato. Russo's Gourmet Foods and Market. The way shopping should be enjoyed.
You take pride in the way your home looks, and your garage door is a big part of it. So when you need to have your garage door replaced or repaired, make sure you call the experts at County Garage Door. We'll walk you through the process from start to finish, whether it's choosing the door that's right for you, installing a quality garage door opener, or simply repairing the door you already have. Our highly trained and courteous staff is eager to deliver the service you deserve. County Garage Door. Quality work, total satisfaction.
That creature sucks.
That's first edition. That doesn't count. Actually, it's third edition.
What about second edition? You ever think of that?
Any questions?
Be a hero. Please give to United Way. Your support makes a difference in the lives of local people. Together, we're improving the lives of children, families, and seniors. We need your help to build a stronger community for all of us. With your support, we can make lasting changes right here in Berks County. Together, we can change lives.
We're back now for part two of our sit-down with Dr. Harriet Comite. She's a board-certified dermatologist. And we're talking about dermal fillers, which means stuff you fill your skin with, fill the wrinkles with more appropriately.
Exactly.
You brought along an example of Juvederm. This is what it looks like when you get it shipped to your office. What are we looking at?
This is Juvederm Ultra. It's a hyaluronic acid-based filler. It is used to plump deep lines, and it's an excellent filler for the lips. It feels and looks like the real thing. After you have it injected, you can't even tell it's in there. And of course, it should be done naturally.
This is actually one of the newer fillers, too, in that it was only made available, I guess, last year.
Exactly. It was made available last year, and it's actually approved to last between 6 and 12 months.
Some people might be a little nervous in that, gosh, we're putting a foreign body into our skin here. What are these products made out of, and do we need to worry about years down the road something happening bad to our face?
No, you don't. These are actually, hyaluronic acids are naturally occurring substances that your own skin, your own body produces. So this is very natural. As a matter of fact, the wonderful thing about all the fillers we have available today is there's no allergies to them. So you can come into the office, discuss your needs, and get the filler done immediately without any allergy testing that we had to do years ago with collagen from bovine, from cows.
Is there a particular age that you recommend women or men begin coming in to start kind of working on certain areas, or is it something that kind of varies?
It varies, definitely. There are some people who have scars that may be quite young that would need fillers, and other people, as time passes, faces change, proportions change, and with a little bit of filler, you can get back the youthful, younger-looking proportions that you had previously.
So how about the guys, since I mentioned them? How frequently are you seeing the males in your office coming in, maybe the metrosexuals a little bit, getting a little bit of the filler, the plumper cheeks, that kind of stuff?
We do see a good portion of men, mostly women, but I would say 20-25% are men who would like to either smooth their skin. They may have acne scars from years ago that are becoming more visible as your skin loses the plumpness with time. So I do see quite a few men. Usually men do not get their lips done.
Although I'm sure there are some out there. I want to show you one more before and after before we let the doctor go today. This woman basically came into the doctor because she wanted some more fullness, wanted to look more youthful.
As you can tell from her picture, this is a very happy, pleasant patient.
She doesn't look very happy, I have to be honest with you.
No, she doesn't. She looks sad and she looks worried, and it's all her expression because she has what we call marionette folds around the corners of her mouth. So she looks like she's very sad. Actually, French call them bitterness lines. And her lips are pretty flat, and when lipstick goes on, it doesn't stay there very well. But after a treatment with fillers, inside her lips and around her lips, we did Juvederm and Cosmoplast, and to plump the lines between her nose, mouth, and chin, we used Juvederm, something similar to Juvederm, actually, previous to it, and she looks like a totally different person.
She looks a good 10 years younger at least, and I think it's worth mentioning that this is all done without using any knives, any scissors, cutting into the face. You're talking about something that might take about an hour to come in and do?
Right. This is not surgery. This is simple injections, and you get these results instantly.
Really neat. Almost out of time now, but do you foresee these kind of things being covered by insurance in the near future? Because I think we're all kind of jumping at the bit now. We want to get this done.
No, unfortunately, insurance will never cover these. They're cosmetic treatments, and they just do not cover cosmetics.
But psychologically, we'd all be so much happier if we looked better, right?
I agree.
All right, we're going to have to write some letters or something. Dr. Comte, thank you so much.
Thank you for having me.
And if you're interested in setting up your appointment, you can visit Dr. Comente's website at cometeskin.com or call 610-374-1400. Now we want to make you aware, too, of a 10% off coupon. That's right, for Botox or any of the fillers that we talked about today. Limit 1 coupon per patient. And you can redeem that coupon in the office. You have to get it, though, online at that website, Comcast.